Every decision you make, there is a calculation, the potential reward for the risk that you take. I spoke with someone for whom her death was the risk.
Ebola. The recent crisis in West Africa is the deadliest ever. For a Manhattan emergency room nurse, the outbreak was a catalyst. When the disease hit the U.S., Lindsey Hallen wanted to stop the spread by going straight to the source. She had a choice: volunteer where she would have no contact with ill patients, or help some of the sickest. In a 24-hour flash, she chose to go to Sierra Leone, where more healthcare workers have died than anywhere else in the world. I asked her the question she hates most: why?
To get the option to choose right before I was leaving, it kind of threw me for a loop, and I wasn't sure what to do. But
you had 24 hours,
yeah,
right?
I had to decide pretty quickly. But ultimately, I think with my experience working in the ER and what my expectations were and what I was preparing to do, it was to treat patients, treat the sickest patients.
Your dad compared your decision to a firefighter who runs into a burning house.
Yeah.
What was the biggest shock to you when you got to Sierra Leone?
Just the conditions and the environment that these patients are fighting for their life in. It's totally unacceptable, and it's not okay, and that would never be the case here. And realizing that that's what these people are going through was kind of shocking.
I referenced your dad's comments, which puts you in a heroic light. I know your mom cried, which is, as I know, is a normal mom, but your sister said, essentially, you've always been a risk taker. So I have to assume this is part of what, in your character, permitted you, for lack of a better term, to go.
Right. Yeah. I mean, I think this type of work sort of attracts a certain type of person, and some people are excited and, you know, get some sort of thrill out of doing something like this, and some people, it's not for them. And I don't think one is better than the other. It's just, it just seemed like the right thing to do for me.
You've been back a few months. What has it been like to reacclimate? Because obviously it's a very different environment in West Africa than it is on the Upper East Side of Manhattan.
Yeah, it's very different. The first few weeks, I still felt very connected to my experience and to the people I worked with. And now that it's been some time, I've kind of gotten back into my routine and, you know, just my ordinary life. And I don't want to forget about that experience. I don't want to forget about the people I met. I don't want to forget about all the people who lost their lives. And so I think it's important to keep talking about it. And it's hard for people to hear the things that we all experience there and the conditions that these patients are in. But I think it's important for people to know and to not sugarcoat it.
When you say you don't want to sugarcoat it, what is the most important thing for people to know here about what you saw there?
I mean, we never knew what we were going to see when we would walk into the treatment unit after not being in there for a couple of hours. Patients who were alive before are now dead. Patients would pull out their IVs and they might be sitting in a pool of blood. They would defecate on themselves, be vomiting in buckets. I mean, it's just totally unacceptable. And I think it's important for people to know that that is not the treatment you would get here, and there's no reason for why there should be a difference.
I know when you came back, you were essentially quarantined. You couldn't be here in the city. I know you went out to Montana because you had friends there, but you had to call the CDC every single state that you passed through to let them know where you were.
Yes.
Did you resent being tracked?
I mean, I understood it. I never was symptomatic. So it was difficult during the quarantine period because you felt like almost like ashamed of what you were just doing because you couldn't really talk about it. You didn't really want to tell people. You didn't know how they were going to react. So it was kind of like you had to keep this secret instead of, you know, being proud of the experience and telling everyone that you met what you were just doing.
On the last day that you were there, you got devastating news about another volunteer, somebody that you worked with was infected?
Yeah. There was, we had an emergency meeting the last day that I left to say that one of our coworkers had tested positive for Ebola, and I flew out that night. So arriving back in the U.S. After hearing that and then finding out about a second colleague, a Sierra Leone national, who was also infected, was hard for all of us because you've just spent the last however many weeks or months helping these people and working with your coworkers, and then you go home and you're alone, and you don't have anyone there with you, and you feel completely useless. But luckily, everything turned out great for the two of them, and they both survived. And I'm sure we'll be dealing with recovery for a while, but we're all very happy that it turned out the way it did.
Lindsey Hallen, she is an emergency room nurse at Lenox Hill Hospital here in Manhattan and a volunteer to treat Ebola patients overseas.